fortunate, trying to not go off the edge here. We are fortunate to have a great mix of perspectives on the panel. A government provider of data, two representatives of nonprofit, or and an internationally, not internationally, an intentionally nonprofit journalist, although you might also be internationally known, all of whom are extensive users of government data. So we are very pleased, again, you have all this information in your program, so we're not going to go into bios. We're very pleased to welcome Todd Park, Chief Technology Officer at the Department of Health and Human Services since August 2009. Tom Lee on the end, Director of Sunlight Labs at the Sunlight Foundation. Sheila Krumholtz, next to Todd, Executive Director of the Center for Responsive Politics, and Jennifer LaFleur, Director of Computer-Assisted Reporting at ProPublica. So we're going to start with Todd. Todd, you came to HHS about 2 years ago to help leadership harness the power of data, technology, and innovation. You've also been a leader in work on open government, part of the Open Government Working Group and the leading edge stuff. What do you see as the major changes, particularly at HHS, in the deployment of data and its use both inside and outside the government? And I'm going to come back to you, after the other panelists speak, and ask for your response to their critiques of government data. So I'd ask you to keep this first answer short.
Sure. Well, from my perspective, there is a big and mushrooming change happening at HHS, which is what I know best.
Right.
And it's probably best exemplified by something that we are calling our Health Data Initiative. Mm-hmm. This was actually born about a year ago as something we called our Community Health Data Initiative.
Right.
And what was happening was that we were trying to think about, well, how can we really maximize the power of the data that we're sitting on, right? HHS consists of Center for Medicare and Medicaid Services, NIH, FDA, CDC, et cetera, right?
Huge, yes.
Unbelievable amounts of data sitting in our vaults and used for very narrow purposes by a very narrow circle of people. We said, look, it can do a lot more social good. So what can we do? So we actually looked to our left and saw an agency called NOAA,
right.
The National Oceanic and Atmospheric Administration, which now famously, right, which I didn't know, famously collects virtually all weather data in America,
right.
and publishes it online in machine-readable form, downloadable for free to anyone,
right.
without intellectual property constraint, right? And then other people turned into weatherspark.com, weather.com, Weather Channel, nightly newscasts, iPhone weather apps, crop insurance, weather research, et cetera. We said, that's awesome.
Yes, yeah.
We want to do that.
And they've been doing it a long time.
Yeah, exactly. And so we said, well, we want to be the NOAA of health data. So we basically pulled together a group of really innovative thinkers, March 11th of last year. They included deep healthcare rock stars and deep tech rock stars, including actually folks from Sunlight and so on and so forth. And they said, this is a really good idea. You should do the NOAA of health data thing. And we said, okay, well, why don't we start with particular data sets focused on community health and provider quality, like hospital quality. And if we put that out in a really easy to use, really easy to download, really easy to manipulate way, a week from now, can you turn into a whole bunch of cool apps for us,
right.
Just to show us what the world can do. And then less than 9 days later, June 2nd, the Institute of Medicine and Secretary Sebelius hosted a big public meeting where these innovators debuted 20 plus either brand new or upgraded applications that took this data and did incredible things to help bring transparency to healthcare, help consumers make better decisions, help people understand what's going on. And it was just an amazing display of the power of American innovation, right? So then we said, we are all in.
Right.
And what's happened in the months since then is we've morphed Community Health Data Initiative into something we're just calling the Health Data Initiative. Because essentially, our attitude is if it's not illegal to publish it, we want to publish it in machine-readable form, downloadable, preferably increasingly via APIs, without intellectual property constraint for anyone to pick up. It's community health data, it's provider quality data, it's provider directories, it's consumer product data, it's insurance product and pricing data, it's medical and scientific data, it's government spending data. And I mean, I could go on and on, because I'm pretty enthusiastic about this.
Yeah.
But I mean, everything from the first ever claim level Medicare spending files made downloadable for free to the public, to a giant new health indicators warehouse at healthindicators.gov that enables you to see at the national, state, regional, and county level public health, health care utilization, prevalence of disease, determinants of health performance, including about 150 indicators of Medicare performance, quality prevention, utilization services at the community level, never been published before, and available actually not just on the website and downloadable files, but also critically via web services API.
Right.
We've taken existing data sets that are very popular, like Hospital Compare, put APIs on them, We took the FDA recall database and made it downloadable in XML form, which is a suggestion from Sunlight, by the way. So we're just on a data publishing rampage, essentially. And because it's actually kind of overwhelming to absorb in all these different places, we have created a new community on data.gov called healthdata.gov,
Right.
which we launched 2 weeks ago, where all this stuff is actually published in an easy to find way. The APIs and data sets in an organized, hopefully well-categorized, searchable way, along with a apps expo that shows a growing cross-section of super cool apps people have built using the data, a forum where you can actually complain about the data, ask questions about the data, et cetera, request new data.
I think you could go on.
I could go on and on. I'm so sorry. Anyway, so we are all in. We are all in.
Right.
And we think that the best way to actually take advantage of our data is to have other people take advantage of it, right?
Right.
I mean, it's Bill Joy's old saying that, no matter who you are, you got to remember that most of the smart people in the world don't work for you, right?
Yes,
and
right.
so really the trick is, give them the data.
Right.
They'll figure out what to do with it.
Okay.
And they'll improve society, improve the health of the country.
Right.
Do incredibly cool things as a result.
Right. Great. Thank you. So a little overwhelming. Tom.